Heart disease is the leading cause of death in the United States, and this preventable disease is the most widespread and costly health problem in the country. The modifiable risk factors associated with heart disease include high blood pressure, high cholesterol, cigarette smoking, unhealthy diet, physical inactivity, overweight, and obesity. These risk factors cause changes in the heart and blood vessels, which can lead to heart attacks, heart failure, and strokes. Approximately 78 million Americans have high blood pressure. That is 1 in every 3 adults. High blood pressure, or hypertension, is when the force of blood flowing through your blood vessels is consistently too high. Normal blood pressure is when the systolic is less than 120 and the diastolic is less than 80, whereas hypertensive patients have blood pressure readings of 140/90. High blood pressure can be classified in several different categories depending on the pressure reading. Each stage influences different treatments as the disease gets progressively worse. High blood pressure is known as the silent killer because most of the time there are no obvious symptoms, so many don't know when they have it. When left untreated, numbers that are higher than normal can cause permanent damage to the body and can become a significant contributing factor to stroke, heart attack, kidney failure, and blindness. The goal of Healthy People 2020 is to reduce the proportions for adults with high blood pressure to 26.9%. The prevalence of chronic diseases and related factors is higher in Mississippi than any other state. Mississippi has the highest cardiovascular disease death rate in the nation, with 240.5 deaths per 1,000 compared to the national average of 168.5 per 1,000. In Mississippi, 4 out of every 10 adults reports high blood pressure, with the highest prevalence being Black females. 49.7% of Black females report high blood pressure compared with 31.3% among white females. Prevalence of high blood pressure increases as poverty increases, and also as educational level decreases. A community-based educational intervention to target these women at risk is needed to help decrease the rates of hypertension among this population. The stakeholders would include the community health workers, local health departments, medical professionals, health insurance companies, and families and friends of those with high blood pressure. This intervention will focus on using trained female community health workers to help increase knowledge and importance of knowing communicable diseases such as hypertension, identify the population's major risk factors, take blood pressure screenings, and provide health education. This health education will provide information on how to reduce the major modifiable risk factors, such as cutting out excess salt, exercising, managing weight, limiting alcohol, not smoking, and managing stress. Prevention is number 1 in reducing the proportion of the population with high blood pressure. Healthy People 2020 provides a useful set of targets for these efforts, and with proper prevention and management tools, there is promise of expanding a healthier nation.
Created using Powtoon.